All right, so thank you for the global tallies of the past 24 hours then. Health officials here in the country have decided to maintain the country's current COVID-19 prevention measures. Choi Min-jung joins me now with details on that. Min-jung, welcome.
Thank you for having me.
Right, so social restrictions in place right now have been extended. Min-jung, tell us more.
That's right, Sunny. The government has decided to extend the current social distancing measures for another 2 weeks starting from next Monday. This means that social gatherings will remain limited to 6 people and businesses must still close at 9 p.m. During a morning briefing, Prime Minister Kim Boo-kyum said the decision was prompted by the need to curb the spread of the Omicron variant. Although some experts had suggested a move to ease restrictions, Kim said safety remains our top priority for now.
It is difficult to predict the aftermath of the Korean Lunar New Year holiday, and the number of confirmed cases is growing day by day. The first priority is to slow the spread of Omicron, which is now heading towards its peak.
The government has vowed to do its best to implement an Omicron-tailored response strategy for the next 2 weeks, stressing that speed and efficiency are the most crucial factors in overcoming what could be our last hurdle in the pandemic.
Right, hopefully it will be our last hurdle then. Meanwhile, on the treatment front, Min-jung, Paxlovid will be offered to more COVID-19 patients here in the country. Tell us about that.
That's right, Sunny. Authorities have decided to lower the age requirement for oral COVID-19 treatments. Starting Monday, people aged 50 and over will be able to receive antiviral COVID-19 pills. As of now, only those aged 60 and over are eligible, but considering the fact that people aged 50 and over take up more than half of all people with underlying health conditions and at high risk, officials have decided to include those in their 50s as well.
Right, and staying with treatment efforts, Min-jung, how are authorities tackling the escalating numbers of COVID-19 patients receiving care at home?
Well, Sunny, Korea has seen a surge in the number of COVID-19 patients recovering from home. As of Friday, the figure stands at more than 104,000 people. This is an increase of more than 7,700 patients over a one-day span. Previously, monitoring was done 2 to 3 times a day, but to keep up, officials have decided to reduce the number of health checks to twice a day for those at high risk and once a day for those at low risk. They may also forego daily health inspections for asymptomatic patients or those with mild symptoms. Instead, these patients could be asked to monitor their own health condition and report to medical staff only when necessary.
Right, I see. Also, as you mentioned during our talk yesterday, that would have been Thursday, of course, clinics within neighborhoods have started to share the burden of testing and treating COVID-19 patients. How did that go on day 1, Min-jung?
Well, according to one of the clinics, the first day went pretty well. The use of rapid antigen tests in particular was well received by the medical staff, with results being obtained in just 5 to 30 minutes, whereas PCR test takes 4 hours. People visiting the clinic said that quick and easy testing is also one of the main advantages of this new testing protocol. However, there was also some confusion on the first day of implementation. Initially, the government had planned to designate more than 340 local clinics and hospitals to provide these services, but this fell short on the first day with only around 200 medical centers available, which is around 60% of what was originally planned. However, the government did say that as of this morning, more than 600 clinics and local hospitals have started offering these services, and more than 2,300 are willing to do so nationwide. People should note that not all designated clinics and hospitals provide the full range of services that include everything from testing, prescription, and home recovery support. So people need to visit the Health Insurance Review and Assessment Service homepage to check which services are available at each clinic.
Right, I see. Right, then, Min-jung, thank you for now, but do stay behind for these extended talks.